Hi guys, my name is Atanu Mukherjee. I am an intern who's working in AM Sheikh Homeopathic Medical College and hospitals. So I've recently started off a channel named Healthy Lifestyle. So what are we supposed to be expecting in this channel? The channel is all about sharing health tips, my knowledge of homeopathy, which I've studied for 5.5 years and tried to apply as much as possible. Then basically it's going to be a channel where we discuss medical stuff, health stuff, keeping a human alive and healthy. That is my plan here. So the reason I'm making this video is to address the problems which I've faced as a student and as a junior who is either looking out for a reference video or is also thinking in what way should I pursue this particular subject called Materia Medica, which happens to be the medicine system in our uh, homeopathic treatment of mode of treatment. So the thing here is I have decided to address a particular drug in a particular video. One such drug, which I am going to name today or explain in detail or as much as I have understood, is alumina. Alumina is basically oxide of aluminum. So, as we all know, aluminium group, or rather the metal groups, we see that there is dryness of mucous membrane. Okay, the subjects are tall, slender, and their mucous membranes, or rather even their skin, is towards the dry ear constitution. Okay, now coming to the mind is actually very hasty and hurried. He cannot make up his mind whether to do something right now at this point of time, or he should do something better or and save his time. So he's always in confused state, but he's also very confused about his personality, his own decisions, etc., etc. Coming to sensations of the head, there is vertigo, and hence this can be a remedy which can be given for problems like vertigo, motion sickness, many such diseases which involves people feeling dizzy and etc. Next, the scalp of this person is usually dry and numb and it itches heavily. So what happens is he tends to lose a lot of hair because the oil secretions which keep our hair healthy is actually missing, or rather very scanty. Okay, now coming to the eyes. Okay, he can see stuff yellowish, as if for example, if I see a person who's wearing a white shirt, I can make it out that that person has worn a white shirt, but this person thinks that that my shirt might have a light tinge of yellow. So this way he gets a little confused in that. And there is dryness and difficulty closing and opening of eyes, because when the mucous membranes are dry, the movement of eyes is affected, right? So that is one of the key features. Then you can also look at one of the features that's like really gets pointed out as aggravation in the morning, especially the eyes opening and closing thing, and the lids becoming dry, and the inside of the eye becoming dry is some a very common problem which is faced by these people. Now coming to the nose, there is injury or ulceration at the tip of the nose, and there is mucus drops out. A very sticky mucus drops out from the posterior nares, and it becomes difficult even breathing sometimes, because there is stuffing up feeling of the nose. Now coming to the face, we see the face has lots of pimples and mouth. The mouth, there is soreness, there is ulcerations in the gums which bleeds, etc. Throat, throat we see again, it's very dry and is sore. It's in a very relaxed state, the larynx and the pharynx especially. In the pharynx especially, there is difficulties swallowing, and in larynx there is this tickling sensation where the person is unable to lie down, because as soon as he lies down he feels, his cuff is getting aggravated. Now coming to stomach, here there are very characteristic features that you can really differentiate the drug from other drugs. Craving for chalk, charcoal, and dry fruit, etc. But his conditions are aggravated when he consumes potatoes, aggravation from potatoes. Okay. And also aversion to meat. Has no desire to eat meat. Even though initially he might come from a family or a background where meat is abundantly eaten, he will not suddenly feel like eating meat for a while. There is constriction of the esophagus, as I was telling in the earlier point, and there is also abdominal colic, painter's colic, and there's a difficulty passing stools because there is dryness of mucous membranes. The rectum is so dry that even if soft stool has to be passed out, as if it's a struggle and really difficult job to do something. Next comes urine. The bladder muscles, a point which I had forgotten to mention earlier, the bladder muscles tend to become paratic. Even other muscles in the body, especially in old age, people who become uh, senile or old prematurely, is an effective medicine in such cases. And finally coming to menses, menses are early, very scanty and pale, and there is great exhaustion right after it. And leukorrhea is produced transparent and ropey in character, and there is burning sensation in it. Now coming to the respiratory part. The respiratory part, we can see that there is hoarseness or there is aphonia. Aphonia as in he tries to speak but there's no voice coming out of his voice box, and it becomes difficult communicating. There is again tickling in the larynx, as I mentioned earlier. Then back, there is a gnawing pain along the spinal cord, and there is again paralytic weakness in the lower parts. Extremities, legs feel asleep, especially when sitting legs cross-legged. Okay, we tend to need to remember that whenever a person is sitting cross-legged, his if his legs feel numb, alumina is a drug which we can think to prescribe of. Staggers on walking. Staggers is a word described as something very shaky and not very stable. So he's very confused. I mean, confused is a mental term, but in a physical way, he's not able to walk in a stable manner. So that's how. Heels feel numb, and that is one of the reasons he's not able to walk, properly. And there are nails also become brittle, and he cannot walk without keeping his eyes open. Like for a normal person, for a small distance he can keep his eyes closed and walk, right? But these people immediately stop if their eyes are closed. uh, the sleep of such people is usually very anxious and has confused dreams and feels very sleepy in the morning. And here comes the skin. The skin is intolerable. Itching sensation is felt whenever he feels the warmth of the bed. And the modalities are usually, as I mentioned earlier, worse from eating potatoes, worse in the afternoon, worse in the morning on waking up, and feels better in open air, damp weather, and in evenings. So, this is a drug which is something quite characteristic, but you have to keep going through the drugs. Right after you watch a video, go through the drug yourself in order to remember it well. Okay, so if you if you think I've made a proper attempt, a decent attempt at making a normal, or rather, let's say an average video, please like, share, and subscribe my channel, because this will keep inspiring me to work hard and make better videos over the time. And I hope you will forgive me for the mistakes I've made in my very first video. Thank you. Bye.